Hello, I'm Dr. Russell Libby, and I welcome you to the world of medicine. You know, we usually hear about traumatic brain injuries when some celebrity happens to befall one. Last year was Natasha Richardson. Seemed to be a simple fall on a beginner's ski slope, and it killed her. One of those things that we really just can't explain. Other situations, we have someone like Tim Tebow, an All-American football player, leading his University of Florida team through a national championship season, had to sit out 2 games because of concussions. And then you look at some of our older sports figures, very famous as well, Muhammad Ali, punch drunk as they say. He's lost a lot of neurons and has developed a chronic and permanent neurologic condition that has been around for quite a few decades now that's very much like Parkinson's disease. We know head trauma, injuries to the head, can cause some significant problems. But it doesn't just happen to celebrities or athletes in the spotlight. It happens to all kinds of people, and especially to our children who are playing competitive sports, are doing recreational activities, playgrounds, on the street, on their bicycles, things of that nature. We're going to learn today a little bit about what happens to the brain when you get a traumatic brain injury. We're going to learn how we respond, what kinds of symptoms kids might have, the early ones, the later ones, what impact it might have on their mood, on their personality, on their learning. And we're going to learn how we monitor them from some very special people who are here with us today. We have a pediatric neurosurgeon, Dr. John Myceros from Children's National Medical Center. John Almquist, he is the director of athletic trainers at the Fairfax County Public Schools, oversees all the work that these folks do to monitor what happens to our kids in high school sports and in, just the regular PE classes that they might participate in. And we have Dr. Jerry Joya, who is a neuropsychologist. He works at Children's National Medical Center as well and runs their SCORE program, which is something we're going to hear about a little later on. It's a very important clinic that they've developed to help with kids who do get concussion injuries and may need to be followed for a period of time. And we have Roz, who is also an athletic trainer here with us. And I want to ask you, I know just because we don't have a lot of folks to tell us about their experience, but really, you came upon this beautiful little girl and you heard that she just hit her head.
It did. She had fallen on a scooter. She'd taken off with her sister and fallen on her scooter, and the neighbor found her, and she appeared to be fine, and the neighbor just called me down to come and help her home.
And of course, she looked like she was, getting her wits about her at the time.
She was fine. She was acting a little bit tired, but she just had a sleepover, and she just was, tired and wanted to go home and had a couple scrapes and bruises and things like that and wanted to go get them fixed up, and we started to try and walk home, and she decided she was too tired, she needed to lay down, and it's what my first alarm was, that something much more serious was going on, and I found a really dark spot on her head where she said her head kind of hurt, and went straight for the ER.
Right. Well, we're going to hear a lot more about what happened to you, and maybe you'll tell us a little bit if you remember anything from the incident. But traumatic brain injury, obviously in this situation, Mom was pretty hopeful. This little girl was getting up, was walking, was maybe a little tired. Sure, that's acceptable. You just had a sleepover. But then things went sour. But it was all traumatic brain. So I guess, Dr. Myceros, tell us a little bit about what a traumatic brain injury really is and how we conceptualize it.
Any trauma to the, we differentiate between closed head injuries and penetrating head injuries. Penetrating head injuries are a completely different subject, gunshot wounds to the head and so forth. What we're going to speak about tonight, and the majority of what we see, particularly in children, are closed head injuries. So a strike to the head, multiple, unfortunately, non-accidental traumas where babies are perhaps shaken. Children like Darian who've had actually a fracture, but the skin is not open, so it's still closed, and we'll talk a little bit later about what happened to her. And the range of sequelae may be nothing, If you gently hit me in the head, nothing will happen to me. All the way to the extreme, which would be either coma or death, and perhaps even a persistent vegetative state. So the spectrum is enormous. The injuries that occur to the brain are not completely clear, even with detailed imaging like an MRI scan. But the recovery, being a pediatric neurosurgeon and most of us taking care of children, one of the benefits of this is that children respond and recover much better than, say, I would to an identical injury. So, moms are always right, and Darian's mom was correct in picking up that she just didn't look right, even though she wanted to go home, even though she was speaking. You mentioned Natasha Richardson. She did the exact same thing, but she was an adult, and she did not want to go to the hospital, and they listened to her. And ultimately, that was the reason that she died.
And it's amazing what adults will do. So the older you get, the more resilient you are, but the more impactful the injury will be if it really is injured. Kids tend to be more susceptible just by virtue of, I guess, their size and some of the structures not being mature enough. But anyway, I want to understand a little bit, because I think that people confuse. We see the term traumatic brain injury, and that's a nice term for us. Most people would really not hear it. They'd hear concussion. They might hear a contusion. Someone is comatose. Someone got knocked silly. There are some gradations, and some of these things are subgroups under the traumatic brain injury. Give us a little perspective as to what a concussion is, because I think that's what most people think. You get knocked in the head. Did you have a concussion or didn't you?
Dr. Joya can answer that probably from a statistical perspective better than I, but a concussion is when you've struck your head and you're not the same person that you were right before it was struck. So it may be, in my opinion, if you've had a loss of consciousness and you wake up and you're essentially at baseline, you have had a type of concussion. If you've not had loss of consciousness, but you're vomiting or have a headache or have both, you've had a concussion. So a concussion is a very broad term. And there are concussions and there are concussions. There are children who have absolutely no sequelae, and these gentlemen will talk about neuropsychological testing, which ultimately I think is the best way to diagnose and to follow a concussion. But further to your point about contusions and hemorrhages and coma and so forth, a comatose patient is one that's not awake and alert. The definition of coma is that one is not following commands. If you ask a child like Darian to stick out their tongue or to show you two fingers, they won't. They may be awake, but they're not following commands. Typically, they're not opening their eyes and they're not speaking, and if they are speaking, it's not sensical. Contusions are bruises in the brain. If I punched you in the arm and the next day it turned blue, it's because there's blood that's come out of the vessels into the tissue of your arm. The same thing happens in the brain. The brain is very vascular. It has lots and lots and lots of blood vessels. And it doesn't take much for those blood vessels to bleed. So a contusion is a bleed. A hemorrhage is also a bleed, but it's typically contained. A subdural, some people hear that term, subdural hemorrhage, is between the covering of the brain and the brain, and an epidural, which is what Darian had and what Natasha Richardson had, is a hemorrhage between the skull and the covering of the brain. And the tragedy with Natasha Richardson and the good news for Darian is that these hemorrhages, although potentially fatal, are fairly easily taken care of if found and treated.
So they're outside of the brain. That's a good thing.
Yeah,
you have
exactly.
Some that are inside the brain that can be more difficult.
Exactly. And the fact that they're outside of the brain makes surgery a little bit easier, makes surgery a little bit quicker. But the problem with epidural hematomas, and we don't need to get into the specifics of neurosurgery, but they're typically arteries that are bleeding rather than veins. Veins carry very low flow, low pressure blood, and so they leak slowly. Arteries pump. They pump blood quickly, and so epidural hematomas can gather quickly. And that's what happened to Darian. Her mom, when she found her, she looked good. By the time I found her, she looked horrible. She was just about in a coma, and she needed to have an operation.
So the accumulation of blood presses on the brain. Since it's in that vault, it can't really go anywhere but against the brain.
Exactly.
When we talk about these bleeds and sometimes just the bruising, what does it do to the brain itself? But you know what? Let me step back one more second and talk a little bit about what happens inside the skull. We have direct trauma. Obviously, you get clunked in the head, you hit your head on the ground, you have a head-to-head impact. But is that the only part of the brain that gets injured? What happens in a car accident where you don't even hit your head, but you get whiplash? Does that affect your brain as well?
Sure. I mean, the classic description of that is what happens in dementia pugilistica, Muhammad Ali. You know, here are boxers who have repetitive injuries to their brain. And the skull is a closed space, and there's a casing around the brain that holds in the brain and the blood vessels and the spinal fluid. The brain's a little bit smaller than the skull, and it has a little bit of room. And with constant forceful strikes, the brain shifts back and forth, and it can be injured. Somebody can fall and hit the back of their head, but injure the front of their brain. Because when they fall back, the brain sags back and then snaps forward, and when it snaps forward, it hits the bones in the base of the skull, and you may have no injury to the back of your brain, but have a significant injury to the front of your brain. Children can have, and adults can have, diffuse axonal injuries. They can come to the emergency room after a motor vehicle accident with a normal CAT scan and be completely comatose. It makes no sense. You get an MRI, which is a little bit more detailed, and you see teeny little hemorrhages in the brain, throughout the brain, in the brainstem, in the corpus callosum. And the axons of the brain, the little wires in the brain, get sheared like spaghetti. That can happen throughout the whole brain. It can be devastating, and there's not much you can do about it. And the CT scan is very deceptive, but you have the MRI, and it's very telling.
So when you hit your head, it's not just, ow, and sometimes we get that little external bump, which is pretty well tolerated and just a little uncomfortable. But if you have that bump inside the skull, a collection of blood, that's a problem. If you have the kind of, let's say, shaking force, or coup contra coup, as some people might call it, where the brain goes against one side and then against the other, it can cause some significant injury. And then people will develop some cellular changes that will at least not necessarily show up on the scans, as you were saying. You don't often see these things when you look at your imaging studies. Everybody thinks, if I had a normal CAT scan, I'm fine. But in fact, there are different changes that go on at the cellular level.
Well, by definition, if you look at the MRI on somebody like Muhammad Ali, and I haven't, but if you look at somebody who's had a lot of repetitive injury, their brain has atrophied. Atrophy means that it's shrunk. If it's shrunk, by definition, they've lost something. They've lost a lot of the fullness. They've lost a lot of the volume of their brain. And it's because they've lost neurons, brain cells, and subsequently axons. And which of those they lose, I can't tell you. But indeed, at the cellular level, and we can talk about excitatory amino acids and various things that injure the brain after a head injury, there's an enormous science behind all of this. And people are trying to intervene in a head injury. What can we give somebody with a head injury so they don't have these problems? There's a lot of people, a lot smarter than I am, trying to figure these things out. But indeed, you're right. Things happen at this. You don't need a hemorrhage. You don't need a fracture. You don't need an epidural. You can still have a significant injury to the substance of your brain.
And I guess what we're going to talk about a little bit later is when you think you're okay, and then you go back and play, and there's already this biochemical process upsetting the normal function of those cells. and you get another hit, and we're going to hear what happens then. Darian, of course, do you remember anything about when you hit your head?
Not really. I just remember I was on the scooter going to my friend's house, and my sister thought I was stopping at a friend's house, so she started going home, and then I hit my head. And
So somehow you fell.
Yeah.
Hit some sand, some gravel or something that's always out there that every
Yeah.
kid falls on, and instead of scraping your knee, you clunked your head.
Yeah.
Yeah. And someone thought that you were unconscious for a brief period there, but you wouldn't
Yeah.
remember that.
No.
You just sat there and said, "Oh my God, that hurt,"
Yeah.
and you probably got pretty upset.
Yeah.
But then you gathered yourself,
Yeah.
and Mom showed up.
Yeah.
And that was pretty reassuring for both of you at that time. So you started to notice, well, of course, the bruise in the back of her head got you very nervous.
The bruise made me very nervous, and I took her home, and it had a hard time keeping her awake, and just 3 houses down, and we had to actually drive her. She couldn't walk it, and that bothered me. And then my husband actually decided he was driving us to the ER, and on the way there, nothing made sense. Nothing she started saying made any sense. She couldn't put words together. We'd ask her a question, and she'd start answering it and then stop, and I'd ask her to finish it, and she'd tell me she did. And we got to the ER, and everything was normal when we got in there. I mean, she started complaining a little bit about some pressure in her ear and things like that. But even when we went through triage, she was able to answer most of the questions and things like that, but we were still having a hard time keeping her awake. And shortly after that, they took her back and did a CAT scan on her, and it's when they noticed. And in that process, she actually lost consciousness on me a couple times, in and out, while we were doing the CAT scan. And I think that was the hardest part, being her mom, because I knew something was serious, but I didn't know what all we were dealing with.
So, Dr. Joya, when we're talking about the symptoms that are sort of subtle but not so subtle at the same time, sleepiness, some of the symptoms that people may have acutely. Obviously, if you have a significant bruise, you're always a little cautious that way. It's not like just getting the knot on the forehead from the toddler hitting the coffee table, but one that's a little deeper is what you were describing it to be. But we're talking about sleepiness, nonsensical communication. What are some of the other early symptoms we're going to see when people do get a good knock that we have to be worried about?
Well, they classify into several different groups. You know, some of the physical symptoms that we're talking about, obviously the inability to walk, to motorically move. That happens in the more extreme situations. In the less extreme situations, you'll see balance thrown off, and there may be dizziness. Many times there's a complaint of the head hurting, a headache, and just sensory information really bothering the individual, whether it's the sunlight or noise, things like that. Then there's the cognitive difficulties. And so, again, in this situation, which is a little bit more on the severe side, not being able to form one's thoughts and talk, in language coherently, but also just difficulty tracking even what you're saying, your attention being impaired, having troubles remembering what people are saying to you, and then many times really thinking and behaving much more slowly, that really the speed of everything shutting down. Emotions can be also affected, so there can be irritability, there can be an over-emotionality where somebody's crying more than usual or is very upset. There may be sadness. And then the other thing, of course, you're talking about is really the state of consciousness, and that may be literally lapsing into unconsciousness. It may also be just the energy systems, a lot of fatigue, and troubles, kind of managing your energy. So it's those set of symptoms that we will see in those 4 categories.
Dr. Maceros, we often sort of get that basic set of symptoms. If you have vomiting, if you have confusion and difficulty staying awake, and if you look at their pupils and they're unequal, those are the things that most people sort of key in on as significant. Is sleepiness really a significant issue?
That's a little bit of, it certainly can be. In Darian's case, it was. But anybody who's had any significant injury, whether it's been to their head or anywhere else, will attest to the fact that you do get tired. It takes a lot out of you. So, and therein lies the, you tell a parent after a child's hit there, you give them the head injury sheet to go home with and say, if you wake up your child every X hours, well, I'll tell you what, if you take a little kid and you wake them up every 2 hours, they're going to be exhausted. So, and every time that you wake them up, they seem a little bit more tired. Well, is that significant? It's hard to say. You mentioned pupils. Pupillary changes occur in very dire situations. You would need to have, if Darian walked in today talking to me and one pupil was bigger than the other, I'd find it curious, but I wouldn't be concerned. Because people can have, it's called anisocoria. They can have they can have different sized pupils. But in a child who's not waking up and their pupils are of a different size, that's an emergency. Right. It couldn't be more urgent.
Right. And some people get a false sense of security then when they look at the eyes and say, oh, the pupils are equal, you must be fine.
That's correct.
Vomiting, is that always an issue? I guess kids can get upset, they vomit once, but if they vomit multiple times, is that an issue?
Yeah, I think it's, I don't know the statistics, but vomiting once after a head injury is not uncommon. That falls into the whole concussion category. I think that vomiting more than once becomes more of an issue, not just because of a concern that there might be something wrong, but dehydration is not necessarily a good thing, particularly in a very young child who's very difficult to hydrate in the first place. The more dehydrated they get, the more ill they look. The more ill they look, the more concerned people get. So sometimes these children need to come to the emergency room, not necessarily to be worked up, but to get hydrated. Because once, as you know as a pediatrician, dehydration contributes to so many problems. And once a child is well hydrated, oftentimes they feel just fine.
And one other thing, seizures. Sometimes people will hit their head and they'll have a brief seizure. Is that something that's always associated with a grave outcome?
No. Contact seizures are actually not uncommon at all. As a matter of fact, one of the things that we have to deal with a child who comes to the emergency room with a history of a seizure is, should that child be put on anticonvulsants? Should they be put on a medicine to prevent them from having seizures because they had one? And the answer to that generally is no, if all they had was one contact seizure. Darian was on anticonvulsants for a little while because she actually had a mass lesion. She had something pushing on her brain that had a good chance of causing her a seizure. Now, the truth of the matter is that epidural hematomas, which she had, have a very low incidence of seizures. But one seizure, one contact seizure, is not that, it does, to answer your question, does not carry a dire consequence, no. Multiple seizures need to be treated.
And I know that where you work with at Children's National Medical Center, there is some pretty valuable information on their website.
Correct.
With symptom descriptions and things of that nature so people can go and check.
Yeah, you're going to go to childrensnational.org/score, and there's some good information about brain injuries, concussions.
Good. John, you see it from a real different perspective than, I guess, some of what we've been talking about here. I'm sure that occasionally there'll be a child who has a massive injury, and that's, of course, a very catastrophic moment, but probably more what you deal with are kids who do get head dings and want to keep going.
Oh yeah, and the typical sports-related concussion is not the one that needs emergency surgery. It's more the software issue as opposed to the hardware, where there's actually a bleed or a skull fracture. So the trauma to the brain has caused their brain not to function properly. And so many of the things that Dr. Joya mentioned with what we look for in the symptoms, they're looking at different categories. The people's awareness of people, place, and time, the orientation, concentration, the ability for the brain to concentrate, delayed memory and immediate memory. So those are the things we look at first, along with the neurological issues such as the pupils size and the reaction to tracking, pupils tracking, and ringing in the ears and the headache and things like that.
So I guess there's some pretty remarkable statistics with high school football. I mean, there are hundreds of thousands of kids playing.
Right. And we do know that
millions
there's
of kids playing and hundreds of thousands who end up with head injuries that most of which never get really categorized or even identified.
I think that trend is changing. We've been looking at our injury epidemiology for the last 11 years, and we've looked at we've seen a significant increase in the number of concussions. Are the kids getting bigger? Are they getting stronger? Are they hitting harder? And you know, probably a little bit, but not enough to raise that number of concussions significantly. So what we're seeing is a more awareness of the concussions, and the actual definition has changed. You know, it used to be that you had to lose consciousness to really be considered having a concussion, and now we know that there's a lot less impact of, it's not just loss of consciousness, there's a lot of other things that go on, and so they're being identified better, and I think they're being treated better, and we have seen a significant increase in concussions across all sports. To probably fivefold. And over the last several years, when this information about concussions has kind of hit the media, and we've done a lot more research in it as well. So I think the numbers are higher, but I think we're aware of them more, and I think that's one of the things that's important, is that understanding that these mild symptoms are important to understand that they need to rest. The kid needs to stop playing. Don't get hit again. The multiple impacts are so much more dangerous and can slow down the healing process. So the more people that understand what the symptoms are, can recognize them, can better then get the kid away from harm's way. And so we've started an education program years ago, and we've had a lot of the teammates come over to the athletic trainer and say, you better check Joey out because he's not acting right. And it's not only, you know, it's acting different. And I think that's the best way to describe what you need to look for. If they're acting different, sometimes it's sad. But we had one case where this kid that was very, very serious, and every game, he was a team captain. Every game in practice, he was, you know, nose to the grindstone and working hard. And he started joking around right in the middle of practice one day. And that's what brought it to the attention of the athletic trainer. And sure enough, after further evaluation, he had a concussion. It was significant enough that he was out the rest of the year. Wow. So there's, you know, being aware of that and having more eyes be able to pick that up, I think, is important. But then not only knowing what those symptoms are, but doing something about it is essential. So informing the coaches, educating the coaches on, you know, you got to sit the kid out. When in doubt, sit them out. Those are some key things, and the parents as well.
So it's interesting. Someone developed a sense of humor in practice, and that was indicative of that's something that was underlying a big problem.
It was different, yeah.
That's very different.
different.
So, you know, it used to be, and you still see it in college and pro sports for sure, somebody does an incredible job tackling someone head first, and they sort of lose their balance and wobble around. In that situation in a high school game, does the ref know to say, wait a minute, go to the sideline?
Well, actually, the National Federation of High Schools just made a rule change, and while we don't have the actual language of the rule, we did get the press release that indicates that there will be a requirement that the athlete be removed from play for that day if they are seen with signs of concussion. And then Virginia law has just been passed where that also basically says the same thing. No return to play the same day. And that's basically from the information that came from the Zurich Consensus Statement,
right.
Third Summit.
So getting back to what happens when you do get that injury and you go back too soon, and we're going to hear a little bit about a premature return to sports, but even in the acute athletic situation, the impact of another significant head trauma is a geometric, is exponential based upon the same kind of hit that otherwise wouldn't have hurt so bad if he hadn't been hit before.
Well,
you know what I'm trying to say.
Yeah, I think that, you know, until the brain has recovered, if we use the the brain has lots and lots of chemicals, and there's metabolic imbalance after an injury. So brain cells are susceptible to injury and death. It sounds terrible. People lose brain cells from lots of different functions, as we know. But if you have a brain that's vulnerable, is healing, and you subsequently subject it to another injury, it's likely that its vulnerability will set you back further than it would have if it was the only injury you had. It's not unlike if you were healing your leg fracture and it was almost healed and you went and you broke it again. Its ability to heal the second time is not going to be as good. It will likely heal, but it probably won't be as good, and it probably won't be as strong as if you had let it heal completely the first time. And there are kids like John's who come, I don't see them so much anymore because I send them to Dr. Joya. But there are, and it depends on what part of the country you're in. When I was in Cincinnati was a big place for football. Pittsburgh is a big place for football. Texas is a big place for football. And these young men will come in, 16-year-old guys who are 6'5" and weigh 300 pounds and are fast and strong and will likely pursue collegiate, if not professional football, and they've had a concussion, and they want us to tell them it's okay to play. And there's a lot of parental stress, The mother is horrified, and the father said, oh, Joey's fine. So these guys can speak to that a lot better than I can. I don't, when I see a child like that, I don't tell them anymore, you can go back in 1 week or 2 weeks or 1 month or 2 months. I don't follow NCAA rules. The Zurich study, which these gentlemen will talk about, is probably the latest, greatest thing. I just send them to Dr. Joya, and he'll tell them when they can go back.
So there must be some subtle signs for those macho kids who hide their injuries, and ones that are discernible, but obviously, if they had a sense of humor in the first place, it's not going to be that. But what are some of the things we see in the later stages of, more or less, the later effects of a brain injury, traumatic brain injury?
Well, again, those symptoms really start to unfold over time. And one of the things I think is real important to recognize is that some of the symptoms you may see acutely may not be the only set of symptoms. They can unfold later on, which is the reason why in the Zurich conference we decided that any sign or symptom that day meant that that student athlete was done, because they might appear fine within that next 10 or 15, 20 minutes, but may have some symptoms that unfold later that tell us the brain's not ready. So, but as we then progress, we know that the number one symptom that kids experience, oftentimes 80% or more, is a headache. And that headache can be very responsive to the kind of activity you're doing. It can worsen as you're trying to concentrate, or if you're out running, if you're out basically exerting yourself. But we also see that fatigue, and I just say it's not just that you're tired, you feel like the wind is out of your sails. The kids just feel really tired, and the brain's capacity to produce energy is reduced, and so the battery in that brain really drains much more quickly. And then all of those cognitive difficulties can unfold in kids. It really varies, though, and that's why every concussion has to be evaluated individually. And we have to really look and see what is that pattern of symptoms, what is appearing early but may leave later. The early vomiting usually is that first day kind of problem. Nausea, often an early stage kind of problem. It's usually those later cognitive difficulties, the fatigue, the headache, some of the emotionality, the irritability that is not uncommon. Disruption of sleep, not uncommon. Kids having trouble falling asleep. So all those kinds of things unfold over time and have to be evaluated very individually for that person and tracked. And then we also have neuropsychological testing that we do. The Fairfax County schools and several of the school systems in Maryland now also are conducting testing prior to the season, and then can start to test that athlete right after the injury through to recovery to make sure that the cognitive systems, the speed and the memory, the reaction time are all back to their baseline. So we really look at the whole pattern of symptoms and of cognitive functioning, as well as their response when we kind of push them a little bit physically and cognitively. Can they handle that without symptoms? All those things have to be understood in that given athlete before they're ready to go back on the field.
It must be really hard for some of these kids, and probably people think, oh, they're just depressed because they can't play. But it must be really hard because they are sort of spacey. They're not doing as well in school. They want to work out, but it's hard to do. They must beg you for some help. Get us back in the game.
They do. Oftentimes, they've been under that impression that you've got to do a lot to get better. Even with an ankle, when they come into with a sprained ankle for therapy, we were always constantly doing things to make it better. And so it's a little bit more of a change of perspective for them when we have to say, really, you need to rest. We don't want to do much right now. I'm dealing with a case right now where I was on the phone today and I said, Mom, even sitting at practice, I know the coaches want you there and you want to be there as the athlete. It's better to go home at that time and rest. Break up your coursework, break up your schoolwork, take a nap. You're actually going to get back to your team sooner if you can take the time early on. And that's a very different perspective for those athletes.
It's a real challenge, especially as a trainer, to have to convince them. Obviously, it's hugely important because, once again, as we know, it's such a small percentage of them ever end up being able to take those sports to anything that would be worth the potential sacrifice of their neurologic functioning. When you have one of these new athletes coming in, you guys routinely do a battery of tests on all varsity or JV or any of the athletes?
Actually, right now I've been doing a lot of the baseline testing with our athletes. I just had women's soccer in today. And so we coordinate with the coaches to bring the teams in. My focus first is to get a lot of the contact sports in. And then we try and get everybody through as we can squeeze them into the computer lab. The idea when I talk to the athletes and the coaches is I really want a good picture of what your brain looks like on a normal day. Some of you are really good at words. Some of you are very good at reaction time. I want to know where your strengths are so that if something does happen, we can compare and hopefully have a better idea of what's going on with your brain and not have to judge you on a perfect score because maybe you weren't perfect to begin with. So.
Do you have model citizens who come back saying, that's what happened to me, I didn't take care of myself? I know we have, in fact, the law you were talking about here in Virginia is based upon the experience of a young football player in the Washington State, Zachary Lystedt or something of that nature, and they created a law that this law here now is modeled after. And he was a kid who went back to play some more after he got dinged pretty well. He went back too soon. And you really can test and tell when they're really safest to return to the sport.
Well, it helps me feel a little bit more confident. So having some of these sideline tools, we use the SAC-V&I test, which is a sideline assessment tool that kind of gives me an idea if there's something going on initially to hold them out. And then we do use the impact assessments as well. Those just go along with some of my education and some of my gut instinct. I'm not their mom, so I don't know them as well. But they just make me feel a little bit more comfortable in managing a concussion.
And I suppose that it doesn't just portend to football. I mean, there are everything.
Every sport has concussions.
I mean, even PE, I'm sure kids walk into the weight room.
We even had one in
golf. On golf. Well,
and it's very rare. Yeah. But, I mean, it's every sport that you have the potential for a concussion and or, riding a scooter.
Right.
So, it doesn't have to be football.
Remarkable. And of course somebody can get hit in the head with a ball, of course. That's a pretty obvious one. Collisions in the outfield, sliding into first base and getting somebody's knee or whatever that might be. But what really surprised me is reading about foul tips and catchers. Getting dinged off their catcher's mask.
Right. And they have all the protection, but there's still the impact in the brain. Still, it still resonates through. And can still have an impact.
Yeah. So baseball's one of those you have to be very careful with. Basketball, kids hitting the floor, and I guess in their effort to save their elbows in the head, sure, trying to save their legs, they tend to take falls more on their bottom and their back, and I guess they can get that whiplash down that way too. Down at Children's, do you end up seeing a fair number of seasonal sports injuries, neurologic injuries there?
You know, the most common thing that we see is from motor vehicle accidents in terms of head injuries. Now, probably the most common type of trauma to the head in the emergency room is a baby who's been dropped or fell. I know that sounds crazy, but it's actually very, very common. And skull fractures to babies, and that's a completely different subject. Skull fractures to babies, does that do anything to their brain? We don't think so. The classic linear skull fracture, of which we see multiple ones every single week, rarely do they even need to be admitted to the hospital, and they certainly don't need surgery. I think football, in the big scheme of things, it's probably football season that leads to the most concussions and certainly the most cervical strains when it comes to spinal cord things.
So, and that's even a topic of significance that we probably won't have a chance to touch on too much, but the cervical neck injuries that kids can get by virtue of the way they tackle and the kinds of impacts that they experience. The sports. So we talked about golf. We talked about baseball. We know we've watched hockey, and we've seen great stars have to sit out game after game, season after season, sometimes curtail their careers early on from getting whacked, getting pushed into the boards, getting hit the ice. I guess skaters in general have that kind of a problem. Soccer is an interesting one because most of the time people don't think of that being a big deal. Is heading the ball a dangerous process in and of itself? Where do you get the head injuries in soccer?
It's not from purposeful heading of the ball. The concussions are a biomechanical injury, as we've been talking about. Some force is transmitted to the head. And in soccer, the typical header is done where one is preparing for that ball. The neck is prepared, the head is really aligned with the body, and you're actually jumping toward the ball, and you're distributing that force really through the body. Now, errant kicks of balls that hit heads where you're not prepared will produce a concussion. We've seen kids that have misheaded the ball, that is, they misjudged, and it, again, moved the neck, and the more force was transmitted to the head. But in soccer, we see a lot of body-to-body contact, two heads going up toward the ball and hitting each other's head. We see actually the penalty where somebody's clearing another person out with an elbow to the head. Goalies are often kicked knee to the head. There's head to the ground when you fall, sometimes to the post as well of the goal. So there's a whole variety of reasons. But purposeful heading, I can count on one hand the number of times I've seen kids in our clinic for that.
Right. Well, that's a good thing. Volleyball. You see those kinds of injuries with volleyball players?
I can't say that I've had a lot that I can think of in the top of my head recently, but, wrestling, cheerleading, some of those other mixed sports, I do see those.
And the wrestling, they're thrown to the ground?
Sometimes
awkwardly.
thrown to the ground. Sometimes the opponent will take a shot and the knee comes up and strikes the head. So, there's different mechanisms throughout the sport that can cause that.
Right. And I guess track and field has some pretty tragic and some scary ones as well.
Hurdles, high hurdles, and usually it's when they trip over the hurdle and then they hit the ground, hit the track. So
pole vaulters, they scare me.
Yeah. We don't have a lot of that competition within our system, but most of the concussions would come from the falling.
Right, the errant shot putters.
Also the cross country.
John came to visit me at school one day, and we had a discus hit the head.
Yeah.
He was just happened to
really?
be there that
Just
day.
for
And
you?
that, just for me. It was
amazing.
a little blood and everything, the whole
Wow.
9 yards. So, yeah.
So, it
that's,
wasn't a direct impact, it was more glancing then, unfortunately. Wow. And we were talking about snow sports. And of course, I love to ski. In fact, just a couple of months ago, possibly explaining why I sometimes jump around from concept and subject to subject, but I was skiing down really fast and hit a little depression, lost my balance, went, one of those beautiful 360s in the air, and boom. And I went in to have lunch and pulled off my helmet, and I'll be darned if it wasn't cracked all the way up the back.
Mm-hmm.
Now, I did lay there for a second and think, is my neck there anymore? Is my head going to work anymore? Can I get up and ski some more? And I did. I probably should have gone in at that point. But nonetheless, things cleared up and I was fine for the rest of the day. But I really cracked that helmet. Helmet use seems to be a key in some sports. I know in the thousands of injuries that occur on the slopes, they say that a significant proportion of them are, let's say, ameliorated or made much less severe by the use of ski helmets.
Well, the helmet itself, is basically built to keep your skull from fracturing. That's its number one job. New technologies are trying to look at how you can then lessen the force that goes, transmitted to the brain. The foam and the padding inside of those helmets are typically to help it fit, stay, properly fitted, and then absorb some of the energy. But there's a fair amount of research going on now within the biomechanical world that's really trying to find materials that will really absorb those energies in the helmets. And we're still searching for that. There may be some new products out there, but they're still being researched.
When you talk about helmets, though, there are, I guess, standards by which you can judge the safety and effectiveness of protection you can get with them. I know that it's like when you buy your kid a musical instrument, you're not sure he wants to play. You don't go out and buy a Stradivarius. You're not going to buy the most expensive helmet out there, but sometimes that may be penny wise and pound foolish.
Well, a lot of the helmets helmets are to be regulated by several different regulatory bodies, and most of those helmets, if not all of them on the market, have to pass a certain standard. In fact, I don't know any that actually are on the market that don't pass the standards. Again, the issue here has to do with how that helmet fits you, how well it fits you is probably the number one issue, and then number two, is it in reasonable condition? Some of the materials can eventually degrade. Particularly if you look at bicycle helmets and they're out in the cold and the heat in the garage and that sort of thing. Right. And certainly with athletic equipment, how they are managed and reconditioned is very important.
And for bike helmets, which I know you have probably several of now, don't you?
Yeah.
Yeah. And you probably wear them just running up and down the steps now.
No.
Not quite. Okay.
Mom's thought about it.
Yeah, I bet you have. But bicycle helmets, ski helmets, snowboard helmets, they all are meant for just a few impacts. And I don't think people realize that either, that many of these helmets aren't designed for forever use. It's my favorite helmet. I've had it for 10 years. Yeah, I've hit my head 12 times with it. At some point, the structure of the helmet starts to decompose, as you were saying, just by normal, decay of the material, but also by those episodes of trauma.
Yeah, some helmets are actually built to break. And in fact, that's taking the force away. So, some of the bicycle helmets are single-use helmets. Right. And actually, they are, as my biomechanical engineering friends have told me, better off doing that. They're diffusing the force away than some of the others that are actually maintained. It's an expensive thing, though, to have to replace the helmet each time. But if it's effective, it may be worth it.
Yeah. And football helmets, though, they aren't quite the same.
They're repetitive hit helmets,
Right.
by design. But in Fairfax County Public Schools, we recondition all helmets, lacrosse and football helmets, every year. Whether they're used or not, even if they stay on the shelf for the year, they don't get handed to a kid.
So the padding gets replaced, or at least gets checked.
The helmet
resilient.
shells get checked,
Right.
and by a certified reconditioning company, and all the padding gets checked. And then, like Dr. Joya said, it's the fit that is also critical in all this. The helmet has to fit well, so that's what most of our athletic trainers will spend the first couple of days of football while they're still only in helmets and not hitting yet, but checking helmet fit. Because even though they get fitted a day or two before practice starts, kids change, and sometimes that's a little bit rushed, but we're continually checking for the first week or two of practices, and then periodically throughout the year as well. And we always check the fit after anyone sustains a concussion too.
Mouth guards, do they do the same thing? let's say, it would seem to me that you could get a more significant trauma just literally by the snapping of your mouth if you didn't have a mouth guard.
Well, mouth guards are important for the oral structures.
Of course, yes.
They really do not prevent concussions at
help.
this point.
No.
Again, there's some research going on trying to see if there's something that could be done. And they may actually, with a mouth guard, they may actually help in terms of how the neck strength operates. But the bottom line is they themselves are not a direct factor in reducing concussions.
When these kids come in, you start with education.
Yes.
Obviously the coaches, well, first the trainers, then the coaches, and then as the teams come in, you spend the time working with them, helping
and
them
parents' nights as well.
understand. Then you have the parents come in, you make sure they understand the equipment and the approach to injury.
Right.
And then you have them reinforce each other that way, so that it really is one of those things that is self-reinforcing and works.
Yes, it has in our setting.
Yeah.
Very well.
And I'm sure that there are times where you're challenged based upon kids who are looking for scholarships and
Or parents who are looking for the scholarships.
Right.
Yes.
Yeah.
But there is always a challenge, but that's what makes this, it's a very difficult decision to return a kid.
Right.
It's a very difficult thing, and that needs to be left to the licensed healthcare professional. Recognizing the symptoms of a concussion and sitting a kid out and protecting them, that can be done by anyone.
And that's a little bit about what that law is about now.
Yes.
That will be signed into law, I guess in July, when those bills normally go to the governor. And how does that elevate what's currently being done?
Well, one of the things that the law will do is require the education. It won't change anything that Fairfax County Public Schools have been doing, but other school systems in the state may not have gone to that level yet. But it also will require the student and the parent to sign a form saying that they actually went through the education. And it will also require that the athlete, if with signs and symptoms of a concussion, they cannot return to play that day. And they have to be released by a licensed healthcare professional.
Right.
Go back in.
And the SCORE program, you'll refer back and forth
Absolutely.
when you need people to be assessed and you need that objective. I'm not the one who's going to send you back because I really can't judge based upon you telling me you're ready to play. You walked across the room on the line between the linoleum squares. That's not good enough. Actually, it is the cognitive part of the brain that you're looking for to recover, to really give you confidence.
Well, that's one of the parts. I mean, so the cognitive testing is important. But, you know, one of the things that both Roz has mentioned, John has mentioned, and Dr. Maceras, you know, it's how you understand that child in front of you. Our clinical kind of knowledge, but also our clinical intuitions as to what that individual looks like. You know, you can look at them in the eye, you can do all of your tests, you can look at all of the symptoms, you can look at their cognitive functioning, you talk to their parents, you find out how they're doing in school. You know, all of that is important in understanding whether that individual is now back to their baseline level to give you confidence that the brain is recovered. It's all important. And, you know, we work very closely. The concussion team is really, you know, the physician, the athletic trainer, and the neuropsychologist working together with the family and the student athlete. And hopefully everybody is reasonably on the same page. And although it is, you know, quite, you know, common that when the athlete comes in to our clinic, you know, they want to get back out into the field right away. But with some education of both them and their parents and seeing how they're doing in their performance, we oftentimes sort of win them over and win their trust and understand that actually we are trying to get them back as soon as we can. And back in the very nice thing about the Fairfax County Public Schools is their athletic training system. It's wonderful to be able to say that person's going back to somebody that knows how to get them onto the field safely.
Well, and as a pediatrician, one of the really big positives for the state is that they require an annual pre-participation sports physical. And that's a time where you can review any underlying medical conditions, any medications they're on chronically, find out if they're taking supplements or other herbals and things that might really have some impact on blood clotting or some other vital organ system that they need to understand they have to be careful about. So a great topic. I'm glad we live in a county that does care that much and provides that kind of support for its athletes. We want to keep kids physically active. We don't want them to get overweight and sit in front of screens and eat all day. And you guys are making it safe, and we really appreciate it. I thank you all for watching. I thank you all, of course, for giving us your great knowledge. And I thank you for sharing your story with us as well.
You're welcome.
And of course, until the next time, I'm Dr. Russell Libby, looking out for your health.